Hello, and welcome to the MEDSURG Nursing Journal podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. Before we get started, we have a special offer for our listeners. You can save 50% off 1- and 2-year subscriptions to MEDSURG Nursing, the official journal of the Academy of Medical Surgical Nurses. Simply visit medsurgnursing.net, click subscribe, and enter promo code MSJSAVE50 to take advantage of this special discount. In this episode, MEDSURG Nursing Journal editorial board member Dr. Terry Jones talks with Dr. Linda Yoder, a professor at the University of Texas at Austin School of Nursing, and Ms. Allison Ferro, a doctoral student also at the University of Texas at Austin School of Nursing. Their discussion centers on career development relationships, the differences between managerial coaching and mentorship, and how career development relationships can enhance one's career. Advice for nurses seeking a mentor is also discussed. We are pleased to present Dr. Jones's interview with Dr. Yoder and Ms. Ferro.
Hello, everyone, and welcome to the MedSurg Nurse podcast. Our topic today is career development relationships to enhance your career as a medical surgical nurse. My name is Dr. Terry Jones. It is my pleasure to serve as the moderator of our discussion today. I am an associate professor at the School of Nursing at Virginia Commonwealth University, and it's my pleasure also to serve on the editorial board of MedSurg Nurse. The two experts that I have gathered together today are Dr. Linda Yoder, who is a professor in the School of Nursing at the University of Texas at Austin, and Allison Ferro, who is a major in the United States Army Nurse Corps and also a PhD student in the School of Nursing at the University of Texas at Austin. These two colleagues of mine are experts in the field of career development relationships. They do research in this area, and I could think of no one better to help us sort of work through this topic today. So, esteemed colleagues of mine, we'll go ahead and get started. And let me just ask a general question. Can you share with our audience what got you interested in the topic of career development relationships?
So I became interested in career development relationships back when I was an undergraduate student over 40 years ago. And I had read an article about mentoring, and like many people, that article made me think mentoring was the end-all be-all. And it wasn't until later when I was in my PhD program that I realized that there was this whole constellation of things called career development relationships, of which there are 5: precepting, peer strategizing, coaching, sponsoring, and mentoring, and they all have a specific place in your career. So that's sort of how things evolved for me.
Allison Ferro here. For me, I found a fascinating dissertation topic I was lucky enough to be introduced to by Dr. Yoder and her years of experience in this area. And I believe that the relationships are relevant to nurses. I believe that they're relevant to the military. And I knew that I could build upon anything in this area for really the rest of my career. There's a lot of work to be done in this area. I've started a little bit already for my dissertation work. And I found it interesting, especially because, as with most new topic areas, I found myself a little bit shocked and embarrassed at how little I actually knew about these topics at first. And I think myself, like many other nurses, were perpetually confusing and misusing the terms, especially coaching and mentoring. And to me, if I don't know something, I immediately want to get better in that area and learn more. And so now I'm not ashamed to admit that I was not using them correctly. And since then, there's been a lot of learning about these relationships that has really brought me to this point.
I'm assuming that there are a lot of us that don't fully understand all of these relationships, as you pointed out. So you talked about the fact that there are 5 defined relationships. So I'm wondering if you could sort of just very briefly talk about what each one is?
Sure. We can start with the most complex relationship, which is mentoring. And mentoring is where a senior person, in terms of both age and mostly experience, enter into a relationship to provide perspective and advice and psychosocial support for a more junior person in the relationship. And this relationship lasts over an extended period of time, and it's marked by substantial emotional commitment by both of the parties involved. Dr. Yoder will talk about sponsoring relationships.
So sponsoring is very time limited, and it's one of those relationships where you need somebody to give you a leg up. For example, if you need someone to sponsor you to become a member of the International Honor Society and they have to write a letter of reference for you, that is a sponsor. Sponsors are typically people that know you fairly well so that they can write those references for you. But it's a very time-limited relationship. It's there for a specific purpose. And when that purpose is fulfilled, the relationship may be long distance. So it's not an everyday type thing. Now, mentors can also serve as sponsors, but you don't have to have your sponsor be your mentor. And as Allison said, mentoring is very complex. It's really intended for succession planning and for the cream of the crop. So these articles that talk about mentoring is for everyone, that's not really accurate.
And then the next relationship that I have become most familiar with through my dissertation work is managerial coaching. And this relationship is a face-to-face, really hands-on process of influencing behavior where the manager and employee, or AAPRN or assistant manager and staff nurse, will collaborate to achieve an increase in skills or knowledge or assistance in carrying out their day-to-day duties. And it will then improve, relationships and the nursing environment and really give opportunities for professional growth and personal growth for the coachee. These relationships are limited to a period of performance or a period of employment, and they do not typically go on for many, many years like mentoring relationships do.
And then I'll talk to you about peer strategizing. There's almost nothing in the nursing literature about peer strategizing, but medical surgical nurses do peer strategizing all the time. They just don't realize that's what they're doing. There are articles out there about what's called peer mentoring. And again, those are incorrect terms. And when they talk about peer mentoring, they're really talking about peer strategizing. And so peer strategizing is when nurses share information about, oh, how did you get that job that you have? Or what do I need to know if I want to go to XYZ hospital and apply for a job there? Or how would I get into home care for medical surgical patients? So peer strategizing is where peers exchange information with each other, and it should be a fair exchange so that at one point in time, one person needs the information and the other person shares it. And at another point in time, the person that received information before shares their information. So it's what's called a reciprocal relationship where there's equal sharing. When equal sharing does not occur, then the relationship falls apart.
And the last career development relationship is precepting. Precepting is, I believe, the relationship we're most familiar with. Most of us have gone through it at one point in our careers. This is a more official relationship. It's usually designated, and it's for a limited time, often a period of a few weeks, to evaluate new nurses or nurses who are new to a particular work area or a particular role, to offer them feedback to help them gain supervised and supported experience in this new area for their practice. And this is usually very standardized within the organization, and it looks relatively the same across most nursing organizations.
Thank you for that overview. So I'm going to repeat back what I think I heard from you to make sure that I'm understanding correctly. So in listening to you, it sounds like almost all nurses at some point have a preceptor, right? That's been our educational process. So even nursing students have preceptors when they're doing their clinical rotations. And when you get your first job, you have an assigned preceptor. So as you all said, it's formal and it's almost very prescriptive, right? They're there to help you do something very specific with one particular job or role. And you don't necessarily get to choose your preceptor. Oftentimes they are assigned to you and it's sort of tied to your job or tied to your school program. And then it seems like nurses move on from that to more voluntary relationships like the peer strategizing, where you identify with someone else. And as Dr. Yoder said, you have a sort of reciprocal relationship where you help each other out. And maybe it's as simple as someone says, I think I'm ready to take my certification exam. Should I take a review class? How did you do it? What do you think? And the other who's already had that experience might share it with you. And then later on, there's another ask. So it seems voluntary, a little less formal, but both parties participate. And then we get into this thing called managerial coaching. And I'm going to guess that oftentimes people seem to confuse managerial coaching and mentorship, that at that level is when there seems to be some divergence in our understanding. So I'm wondering if you could maybe walk us through those two things and how they're different.
Sure. So the purpose of managerial coaching is really to promote individual success at one point in time, providing technical, hands-on information about skills, particular job knowledge, and help that nurse improve. Whereas mentoring, it might not be the case that nurses need something right now. This is more of a long-term guidance where the mentor is that trusted advisor. They provide problem-solving tools and higher level perspective than that employee is normally privy to. And then they can both be entered into formally or informally. So for managerial coaching, it could be the nurse supervisor taking the opportunity to have a formal coaching session to ensure that they're meeting the needs of their nursing staff. Or it could be informal. There is now an opportunity for a technical skill, hands-on, face-to-face opportunity for a more experienced nurse, such as an APRN, the nurse manager, to intervene and provide coaching for a staff nurse. And just like mentoring can be formal or informal. Some of the most strong, long-lasting mentoring relationships are actually informal. There was already a relationship there, and then the mentoring relationship occurred naturally, where it wasn't prescribed or assigned by a chain of command, for example. It was a relationship that developed into a mentoring relationship, or mentors can be formally assigned. And as far as the support offered by these relationships, the support offered by managerial coaching is often kind of a balance of psychosocial and emotional support with that technical hands-on support that's called instrumental support, or sometimes called career-related support. And there's a balance depending on the needs of the coachee. Whereas mentoring support is more pure psychosocial support. A mentor is not going to provide you any technical hands-on skills. It's mostly just that guidance and perspective. And then coaching relationships are usually defined by one level of organizational separation or power differential between the coach and the coachee, whereas mentoring is defined by usually at least two levels of organizational separation or power differential between the mentor and the mentee. And then finally, I can talk about the length of time, which we already kind of touched on, but that is definitely signifies some of the differences and can help us differentiate between managerial coaching and mentoring. Managerial coaching is sometimes one time or limited to that period of performance, whereas mentoring is on average 5 to 10 years. but sometimes lifelong.
Thank you for that clarification. So it seems like managerial coaching is very much tied to job performance, much more so, whereas mentorship is really more broad about your career and probably isn't linked to a specific job, but rather for your long-term goals and where you want to be. This would be someone that could help you process that and think through that and maybe even open some doors for you along the way. Would that be a fair assessment?
Yes, that's correct. And the other thing that goes along with what Allison said is in managerial coaching, really the first line supervisor or nurse manager works with the employee, works with the med-surg nurse to ask them, what are their goals? What do they hope to accomplish on that unit? Are there things that they need to learn to better take care of patients on the unit? And also, clinical nurse specialists may get involved as well. If we're talking about adding to nursing competencies, they can do some managerial coaching along the way as well.
Great. I'm curious, do you have examples of how managerial coaching helped you in your own careers?
So for me, I was very fortunate. I had a wonderful first head nurse when I was a brand new graduate nurse. And she really helped look out for us and would talk to us about what are things that you feel comfortable doing with these medical surgical patients? What are things that you haven't done before? And she would look for opportunities for us to do things that we maybe hadn't done before, like assist with a chest tube placement or help with a central line placement. Or even in my case, I had only put a urinary catheter into a mannequin up to the time when I worked on the unit. So I let her know that I had never catheterized a real person. And so when the opportunity arose, she made sure that I had that opportunity and that there was an experienced nurse with me so that we were taking good care of the patient. But she really focused on our goals as they related to providing the best care possible for those medical surgical patients. And she was very compassionate and kind. So, for example, if your car broke down and you wound up coming to work late, this was before there were cell phones, and you were running in and said, my car broke down, this is the issue. She was very kind about not all of a sudden making you feel bad or making you feel ashamed. So she had this overall demeanor of trying to help the staff.
Great. I think everybody wishes they had that kind of managerial coaching in their career. I'm curious, for those med-surg nurses out there that maybe aren't getting that kind of coaching from their manager, what advice do you have for them about how to change that and create a context where they can have managerial coaching?
I think the first step is that if nurses really understood managerial coaching, then we would seek it out. So step one is to understand and define it. And then from there, I think being receptive to coaching is also very important, where you're, receptive to that feedback instead of, I think as nurses, sometimes we fall into or get stuck in the thinking that we're licensed professionals and that we know what we're doing and we have guidance already. However, if we're receptive to managerial coaching, it can be very beneficial relationship. In fact, nurses have described managerial coaching, once they understand what it is, to be one of the most beneficial relationships. And I think that's something that for me, I've been receptive to coaching, although I might not have called it coaching. I usually have just said to any of my supervisors that I don't get my feelings hurt. That's how I've been saying it, but I really think what that means is I'm receptive to coaching, and that's what I need. And on that same note, I think that nurses should seek out coaching. So not only be amenable to receiving coaching, but to seek it out.
So I would agree with Allison. Ask to have an appointment with your nurse manager. Share what your goals are. with the nurse manager? Are you thinking about going back to school? Are you thinking about getting your certification as a CMSRN? Are you thinking about other types of things that you want to get involved in regarding your nursing career? And so that appointment would be a time to share those things and also ask for help in areas where you might need help if you believe that person can help you. One of the things that I have found most distressing, especially where I live, is that people are using coaching in a negative framework. So nurses are telling me, oh, if my manager says I have to come for a coaching session, it means I'm in trouble. That is absolutely the wrong, most incorrect way to talk about coaching. Coaching is a positive thing. It should not be used to demean anybody or to tell someone they're doing something wrong. It should be used to elevate them. Now, there may be people that are making some mistakes, and those things do need to be discussed, but in a more positive framework and in a way of how can I help you be better, not why are you doing things so incorrectly. So coaching should not be used from a negative perspective.
Since nurses have perceived managerial coaching to be one of the most beneficial and important relationships, I would say to nurse managers or supervisors or anyone who's in a position to be a coach that they should understand that and that they should know that coaching is really for all nurses at any stage of their career. Whereas we put so much effort into precepting relationships and precepting programs, and that's very important, but managerial coaching is important as well. And that can continue after that precepting relationship has ended, and nurses are still hungry for that feedback and for that ongoing performance improvement, and that coaching can fill that gap. And I think that that's something important for anyone who might be able to serve as a coach to understand.
Thank you for that clarification. As you all are talking, the image that comes to my mind, of course, are our elite athletes. They're at the top of their game and they all still have coaches. And their coaches are very instrumental in taking them from good to great. So to your point, it's not meant to be punitive, but instructive and helping people get better and better and better. So I think it's good to remind ourselves that even the elite have coaches, and that probably the winning teams are winning because they have good coaches. So coaching, again, not a punitive thing. So as we wrap up, I do want to ask about your experiences with mentorship and how mentorship has enhanced your career. And then if people are not getting the kind of mentorship, or what advice would you give medical surgical nurses when they think they're ready for a mentor, how to go about that?
So I have to honestly say I've never had a mentor, a true mentor in my career. And that hasn't held me back. I may have had to work harder in some cases, but here's part of the issue. Those nurses that appear to be very independent, that appear to have it all together, sometimes because mentoring is an organic relationship, as Allison pointed out, people have to often see something in you that reminds them of themselves. On the other hand, sometimes mentors gravitate toward people they think need help the most. And so if you appear very independent, they may think you don't need the help. And I think that was my case. I think people saw that I was doing fine and that I maybe didn't need the help that I actually really did believe that I needed, although it didn't slow me down. So I don't want people to think that if they don't have a true mentoring relationship, that it's going to curtail their ultimate career development or their accomplishment of their goals, because it certainly did not hurt me. At the same time, mentoring truly is intended for succession planning. And so mentors really help the mentee be visible in the organization, and be promotable and learn some of the trade secrets within that organization that they would not be sharing with other people. And that's one of the key hallmarks of mentoring, is this sharing of what's called state secrets, where there are things shared with the mentee that would not typically be shared with everybody else, like in a managerial coaching relationship. So it's meant to occur later in your career, from late mid-career onward, and it's meant to enhance promotability and also to fill positions in the organization that require senior expertise.
And for me, now that I have recently figured out what a mentor is and what a mentor does, I believe that I'm well suited to seek out a mentor. And also because I am about mid-career, I think that's great timing, especially because I'm about to enter into a new phase when I graduate with my PhD to something completely new. I think that I would benefit from a mentor who can kind of help me then navigate what's next for me in my career. I do have some thoughts on where not to search for a mentor and what I believe that we've been doing kind of wrong as nurses regarding this really important career development relationship that we've been mixing up. I've witnessed a lot of nurses trying to find mentorship within their peer group with someone maybe they look up to as a nurse. But as we know, a mentor should be that 2 levels of organizational separation, have access to that higher level insight. So a peer cannot provide that. Again, peer strategizing is very important, but it's not mentoring. I also have seen nurses seeking mentoring in online groups or on Facebook. And I will tell you that there's no higher level secrets being offered and given out on Facebook, nor is social media really conducive to that deep emotional connection that's required for a true mentor relationship. I do think ongoing mentorship can be provided, over Zoom or video once the relationship is established, but finding an internet mentor from a pool of strangers is really, really tough. And another thing I think that I would tell nurses who are seeking a mentor or who are recently involved in a mentor relationship is to be sure that they are seeking out that time. They are setting the meetings, asking for time, and then also setting an agenda in advance so that the mentor knows what it is that you're needing prior to the meeting date. With coaching, it might be the coach who's kind of figuring out what needs to be accomplished during that session. Whereas with mentoring, it should really be the mentee who's setting the agenda items so that in case the mentor needs to look someone up or look something up or make an introduction to get that nurse what they need, that they would have time in advance to do that.
Well, thank you so much to both of you for your insights about this very important topic. I hope that our audience finds it helpful. All of us need help sometimes, and help comes in different forms depending on where you are developmentally. So hopefully our audience now has a little bit of insight into what kind of help they need in a particular context, and hopefully they feel very empowered to seek it out if they are not getting it. So you've given us a lot to think about, and hopefully people will integrate this as they work on career development. So thank you so much.
Thank you.
Thank you.
The MedSurg Nursing Journal podcast series is owned and produced by Genetti Publications, Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Linda Yoder is a professor and a Luci Baines Johnson Fellow in Nursing at the University of Texas at Austin School of Nursing in Austin, Texas. Ms. Allison Ferro is a doctoral student at the University of Texas at Austin School of Nursing in Austin, Texas. Dr. Terry Jones is an associate professor at Virginia Commonwealth University in Richmond, Virginia, and is a member of the MedSurg Nursing Journal's editorial board. For archived episodes of this podcast and to learn more about MedSurg Nursing, visit the journal's website at medsurgnursing.net. You can also subscribe to the MedSurg Nursing Journal podcast wherever you get your podcasts. And remember, as a listener, you can save 50% off 1- and 2-year subscriptions to MedSurg Nursing Journal. Simply visit medsurgnursing.net, click subscribe, and enter promo code MSJSAVE50 to take advantage of this special discount.